Hi, I'm Colin Hung from Healthcare IT Today, and I'm excited to sit down with two lovely people from Texas Children's Hospital today. Joining me on the program is Grace Karon, Assistant Director of Business Operations and Strategic Planning, as well as Carrie Rys, Assistant Vice President of Pediatric Faculty Practices and Ambulatory Operations. Welcome, Carrie, and welcome, Grace.
Thank you. Thank you.
Maybe we can start by telling a little bit about yourself and about Texas Children's Hospital.
Sure. So my name is Carrie Rys, and I'm an executive here at the organization. I have responsibility for many of our pediatric practices. We have over 1,000 pediatric providers in our areas, and we have a very large, robust pediatric organization here in Houston. I've been with Texas Children's Hospital now for over 20 years, and I have responsibility for our physician practices as well as our ambulatory operations here in the Texas Medical Center. Grace?
So I'm Grace Karon. I've been with Texas Children's for a little over 5 years, and I have a really exciting role supporting all of Carrie's teams and leadership teams, where I get to focus on a lot of our data architecture and integrity, and that's how we got introduced today, and happy to be here. And then also a lot of our technology implementation, special projects, and strategic planning to say, what are we going to do in the short term at Texas Children's to help us reach our long-term goals from a technology and data perspective, and also to help make sure we reach our patient care.
So I'm excited to talk with you because we heard that at the upcoming Health Catalyst Conference, you'll be sharing some of the efforts that you've done to enhance the digital patient experience. Can you maybe tell us about some of the work you've done in that space?
Sure. So our organization is a very reputable, preeminent destination for pediatric care here in the United States. We're a very large pediatric hospital. And as a result of that, we often have significant demand on all of our programs because we have such an amazing reputation for outstanding clinical outcomes. As a result of that, a few years ago, our organization did launch a journey around improving the patient access experience. And in order to really enhance our access experience, we looked to our technology partners to understand how we could really integrate technology through every step of the access project and process. Really from the beginning, when a patient needs to schedule an appointment, to when they check in at our front desks, to when they see their provider, whether in person or virtually, to when they check out, we really wanted to understand how we can enhance that experience, how we could open up capacity for patients, and just really look at delivering a better experience for all of our families. So we started that project back in 2018. And as a result of that, we have been able to successfully launch and implement numerous digital enhancements to that patient journey to make sure that we're delivering an optimal experience.
Yeah, I think that this is one of the first times that we looked around as an organization and saw that we can't necessarily think of ourselves just as a healthcare organization anymore when our patients are getting used to interacting with the way that they engage any goods and services that they consume. So much of that is moving to a self-service kind of digital platform. And so if you can book your haircut online, you don't want to sit on hold for 10 minutes to schedule your follow-up dermatology appointment. And so with so many other private competitors in the space really adopting and understanding how to best utilize those kinds of technology platforms, we realized that we had to do the same thing here, because that's how people expect to engage with anyone that they consume from these days. And so we've adopted that as a mindset of customer obsession at Texas Children's. And so doing everything to make sure we're doing things not how are we used to doing it, but how do our patients and families that we serve want to engage with us?
I love that term you use, the customer obsession. That's a great term. And you're so right. Like, we've essentially been spoiled by a lot of the conveniences that banks and online retailers and other organizations in our lives have been able to provide. And it's awesome to hear that people like Texas Children's Hospital are moving towards providing those same kinds of conveniences.
Yeah. Absolutely. Yeah, we've joked a little bit in the past that, you don't want to talk to a human. You just want to be able to do it on your own time, not beholden to our office hours. And so taking that from kind of a joking point of view with some basis in reality to a real health need in the last 2 years, where we don't want patients to have to engage with us in person for too long, because we're trying to limit the number of people coming through our buildings and how long you have to be talking with someone, albeit through glass, but either way, or minimizing the number of papers and pens we're passing back and forth. So kind of a consumer preference turned into a real health need last year.
Now, when you rolled out some of this technology, like online appointment booking, some of the other online tools that you have, sometimes we hear that there are some fear and trepidation about using these tools, especially about booking online. I mean, it's still an abnormal thing to do with healthcare. So how did you overcome some of that fear in your patient population?
So I think the way that we've done that is really attempting to partner with our marketing individuals that we work with every day to identify ways that we can better educate our patients and families about the online scheduling experience. So for example, we do have patients that are still coming into our clinic, and oftentimes we have a checkout process where they might be standing in line. And so one of the enhancements we've made is we said, okay, if everyone in the clinic understands that we could really redirect our patients to an online scheduling experience, they wouldn't have to wait in the line. And the same goes for check-in as well, that we could actually really speed up the checkout process and allow them to schedule their appointments online. I also think that in our environment, we're dealing with mostly parents. And so a lot of parents today, they work full time. And so they're wanting the ease and convenience of being able to schedule their children's appointments really after hours, after they've fed their kids dinner, put them to bed, et cetera. And so we've attempted to really appeal at the convenience of online scheduling and look for opportunities to really educate our patient populations on how to use this in real time, wherever they're interacting with Texas Children's. And a lot of that is through our digital platforms and making sure we have good education outreach to them.
Yeah, and something, John, and I'll prompt Carrie a little bit because she can speak to something that I think is an important component of this. For our patients, it was all about education. So how do we make sure that everyone in our clinic who interacts with a patient, front desk, the MA that rooms you, the nurse that is in there with you talking a little bit more, lets you know that you can schedule your next appointment online. So the awareness with everyone in our staff, and that to make sure that there's that education for the families was important. But you said, maybe patients have some fear or trepidation to do that. I would say that that is really not what we found. They want to be able to access an appointment and see their options, not just sit and have someone kind of go through that scheduling tree over the phone. Something that I think has been more of a change management component that Carrie can speak to a little bit more has been more, how can we get our clinics comfortable with it? Because it is very important to make sure that we get the right patient with the right provider to the right appointment type. We have thousands of appointment types and many thousands of providers in our system. And so you don't want somebody showing up and being in the exam room and the provider walking in and saying like, oh, I don't see this kind of diagnosis type. And so gaining that kind of trust and level of comfort, even with our administrators and providers, was, I would say, more of the change management hurdle.
Yes.
And your success speaks for itself. I've heard that you have over 100,000 appointments that have been booked online now.
Yes, we have far more than that. Grace, I know that number has been growing every day. Grace can probably give you a real-time number at this point.
Well, I don't know that I can do that. But what I will, the way that we've been able to gain that kind of magnitude is because we invested in the process and we invested in the technology. So we opted to have all of our online scheduling through our patient portal in our electronic medical record. Previously, we had used an outside contractor, but as we wanted to make sure that we wanted to make sure they had one home base to go to. So for any of the kinds of tools that we wanted to build, we don't want them to have a half dozen different apps to make it to their Texas Children's appointment. So we've really invested in the tools in our patient portal that way. But because we had already had that structure set up and turned on some enhancements such as ticket scheduling, where as opposed to the patient going in independently and reading through everything to try to find where should I go, you can send a patient, I want you to come the second week of October to me, this provider, for this appointment type. And and then it will pop up on their phone as an alert. They click into it, and then it's like I said, it's just, we want the experience to be like anything that you engage with online. It kind of looks like when you want to schedule a restaurant reservation on OpenTable or Resy, where you just see the time buttons and you can pick the one that works for you. Having that kind of flexibility and choice for our patients is very important, because as Carrie mentioned, we're mostly working with parents. And so it's not just getting yourself to an appointment. When you need to be at Texas Children's, a lot of times you need to find childcare for your other children, because currently we're still limiting our visitor restrictions. You got to take your kids out of school. You have to have your own contingency plan to be out of work. And so as opposed to on the phone, where you might say, well, here's the time we have available. Does that not work? No. How about this time? Being able to see your breadth of options is a real patient satisfier.
I really like how you've highlighted that it's more than the technology. Like, it's not just about putting up the online scheduling. It's about educating your staff to educate your patients that it's available. It's educating them on how to use it. It's making it convenient. You've really thought through the entire rollout and not just the implementation of that technology.
Correct. So while Grace was actually talking with you, I did go ahead and look at the metrics, and I knew we were close, but I believe to date we've scheduled over 1 million appointments online.
Wow. Okay. I was off by a factor.
Yes. And so I didn't want to say, I wanted to double check when Grace was actually sharing that, and I knew that we were quite close. So we have been on the online scheduling journey for a few years now. We did have an enhanced focus on it this past year, really looking to optimize all the technology, making it easier and easier for families. And so that's really helped us this last year significantly increase those numbers of adoption.
So you've touched a little bit on this, that families have really enjoyed this and that the reaction has been very positive from your patients. What's the reaction been like from staff after you've implemented these systems?
I think that staff understand the value, and they understand as consumers what they're enjoying and appreciating every day in their lives. And so I think that we've had really good feedback from families. A lot of our patients are our staff members. And so they also have the advantage of getting to use the tools, but I think that everyone's really received it well. And it really has almost been seamless for them, meaning that it's not been disruptive to their day-to-day. Patients are able to access those appointments, and they come in and they're able to see the right provider at the right time. And so our staff have been, largely very supportive of this and understand the value it brings to our patients.
Yeah, and the other thing that we found, and I think when we started this access and technology implementation journey 4 years ago, caused some initial hesitation was, well, what happens if you're automating something that's my job right now? So you're making it so that patients can check themselves in before they arrive, fill out all their questionnaires, update their medication. And now we've even implemented a new workflow where you don't even have to walk to the front desk. As long as all your information is complete, you can hit a button that says, I'm here, sit down in a chair, and they'll call you back just as if somebody at the desk checked you in. But what we found is that there's always so much more work to be done. It absolutely has not replaced what we have, but allows those team members to learn new skills and diversify and find other ways to support the needs of our clinic, because some of that work effort has been moved to a patient-facing engagement.
That's amazing. That's really nice to hear, where the technology works out not only for externally your customers and your patients, but internally as well for your staff.
Yeah.
So I have to ask this because, of course, we've been disrupted, but from a positive perspective, we've seen the introduction of telehealth into healthcare. How has that affected or not affected the online scheduling that you've been doing?
It's actually been a great addition to really our online scheduling options. The reason for that is many times if a patient is completing their virtual visit with their provider, the provider can actually say to them, and you can just schedule your next appointment online right then and there at the conclusion of their virtual visit. And so then they can schedule it while they're sitting there, and they don't actually have to call into a number, a call center, wait on hold, et cetera. So I think it's been a wonderful complement to the development of telemedicine in our organization. We did rapidly expand telemedicine in the face of the pandemic, as many other organizations across the country, and we're really working to sustain that. And I believe that online scheduling is a key element to make sure that patients can have an entirely digital experience if they choose to do so.
Yeah, I think that Carrie and I could talk about what our telemedicine during the last 2 years have been for multiple hours. I know that we don't have that kind of time today. It really has been, I hate to use the word disruptive when I think that it's really so much more of a complement to what we do. You know, a lot of our appointments are only 15 minutes long. And so we serve such a massive population across Texas and, you know, the greater states. And so for a patient to not have to drive 4 hours to come and pay $13 to park, wait for an elevator, get upstairs with their kids for a 15-minute dermatology follow-up appointment is huge. And so, you know, we really have invested in telemedicine, and it was not a substitute or a stopgap. It is going to continue to be such an important, sustainable part of the way that we deliver care. And we're really working hard as an organization to understand what are the most sustainable ways that we can embed telemedicine. So what appointment types are most suitable versus the ones that we really should be seeing patients in person. I think that we found in the beginning that a lot of people still really prefer to come in person, even through last year. And so we were trying to make sure that a certain amount of appointments were in person versus telemedicine. Now, as we're able to have some more people in the building, you know, there's that flexibility of choice that maybe wasn't there summer 2020, but we've actually found that patients select a telemedicine appointment when they're scheduling themselves at a much higher rate than if you're scheduling in the clinic when you're checking out, or if you're calling our central call center. And so I think that that's an important example of when really presented with a dashboard of all your choices as opposed to being offered one at a time. That is something that people really want, is the choice to be in the comfort and convenience of their home if it's not an appointment that really requires that in-person exam.
I really like that. Again, you're mirroring what we as consumers have. You know, they like the choice. They like the ability to decide for themselves whether I want to come in and drive the 4 hours because I feel it's important, or whether or not it's something like, you know, I'm happy to do it via telehealth. That way I can, you know, I don't have to take everyone out of school for as long. I don't, as you said, I don't have to pay $13 for parking. And I don't have to, you know, if I'm worried about it, I don't have to be coming into the building if I don't want to. So that's fantastic that your patients have really kind of gone for the telehealth options. You know, when you look at the sort of the, I want to ask a question really about the ROI. So when you look at this sort of in the short and long term, what are some of those returns that you've seen on implementing this type of technology?
So I think for our organization, there's certainly a cost for every time a scheduler picks up the phone, and we've actually granulated that down. And so we've actually deferred several millions of dollars in expense associated with being able to successfully launch online scheduling. Now, our volumes on the outpatient have continually increased, largely attributed to many of the access improvements that we've made and really opening up capacity. So the volume of calls coming in hasn't necessarily subsided because our volumes in aggregate have increased. But again, that's just less call volume that a scheduler is having to pick up. And so we have deferred several millions of dollars in savings attributed to just our call center alone, and making sure that those patients can use the technology self-service and really doesn't require any staff intervention to secure that appointment. So I know Grace has also looked further into some of the details around the ROI for online scheduling. And Grace, you might have more specific numbers on that, specific to that.
Yeah, the number that's estimated by our EMR that we use, they suppose that for every appointment that a patient schedules online, it saves $7 of staff expenditure, which I don't want to quote an incorrect number, but you know, many of our calls in the scheduling center are not quick, especially these days. So it goes back to what I was saying before, where staff are not doing less work because this is being diverted to a patient self-service option. Last year, every call duration was increased so significantly because they had to share what are our visitor policies, let people know what screening is going to be like when they arrive and what precautions were going to be taking place to keep them safe when they arrive to the building. If they were scheduling a telemedicine appointment, if you're not already active in our medical record portal, which about 80% of our patients are, so it is a very high percentage, and we've focused on that in a big way in the last number of years, so very proud of that number, but there's still a lot of people who need that activation and want you to walk through it with them while you're on the phone. And we want to give that kind of white glove experience so that they're able to successfully complete our telemedicine appointments. We don't want a no-show because they realize that they don't have the app and they can't get in. And by the time they get to the room, the provider's already left for another appointment. And so, you know, there is that quantifiable ROI that industry best practice quotes those kinds of numbers. But to be able to see everybody chipping in to do more to make our patients feel safe when they're here or prepared when they're going to be doing something virtually. But I think the biggest thing that has come out of this is the whole kind of digital life cycle of an appointment, because scheduling is only step one. There's so many things that you can do between when you schedule the appointment and when you have that appointment, whether it's in person or via video, that we've built in to allow people to have that autonomy and do things on their time and do things in a way that minimizes in-person touch points. So you can schedule your appointment, you can check yourself in and answer all your questionnaires and fill those things out. You can get into the virtual room and then via a ticket or scheduling again, it just starts all over again. So I see it like a life cycle. What's been really interesting about, as we've launched a lot of these different technologies, once they've become mature in terms of adoption, you know, we ramp up, we educate, we try to make sure that people know what to use. And then a lot of times we've seen the utilization kind of level off and be steady. Online scheduling is still growing like gangbusters. But some of our other tools, like the self check-in, where you can fill everything out, not have to sit with a clipboard when you arrive in clinic, has really kind of settled and leveled around 2/3 of our patients use it every time. But to me, that's a very interesting story, because that means we have educated people, and once they use it once, they're going to use it again. So that's a tool that we rolled out last year and has been able to see more of an adoption curve. But I think that that is why it's so important to make sure that we know, and our teams know, you know, do I have new appointments or just return appointments available? Can patients also schedule telemedicine online? Because once we get them to do it once, there's a lot of evidence that shows that they're going to get really used to doing it every time. And so a lot of our patients we see multiple times a year, they come to our specialty care centers, they come to our urgent care centers, they see one of our primary care physicians in our Texas Children's pediatric practices. And so once we got them, we got to keep making sure that they feel comfortable with these tools.
Yeah, again, I'm really impressed that you're thinking about this in a holistic sense. Like, you're talking about the digital life cycle of an appointment, which is, you know, sort of a modern term, right? Like, and you're talking about how you're presenting options to the person right at the end of the telehealth appointment, and they have a dashboard and they have different options. I mean, these are things that aren't possible or not as easy to do in a manual world or a paper world, right? Like, to your point, Carrie, you were saying before that, you know, if I had to present all these options as an agent, I probably have to repeat myself 3 or 4 times because it's quite complicated, right? The different times, the different options I have. Whereas if I can just see it on the screen, it can be a lot easier, and I can make my decision a lot faster. And to your point before, Grace, that you're talking about, you know, this is not necessarily about eliminating jobs, as you said. Like, you know, it's not about eliminating the call center. The call center is still needed. It's just that they're answering and having deeper conversations. They're getting to know the individual on the other end of the phone a little bit more white glove, and that overall helps everybody, right? Because they're not having to deal with the quick hit, you know, just get me my appointment, the follow up, all scheduled.
Yeah, certainly. And when we look at our patient feedback, you know, we partner with a survey company, and so we see a lot of real-time information, and most of the negative feedback that comes, when we backtrack it, we find, well, that's not an area that we've gone live with online scheduling yet. So of course they're complaining about a lack of options, and I can't find my provider because they've gotten used to be scheduling in one area. So then when they go to schedule for another specialty that they see, they're frustrated to not have that option. And so we've already gone live with 36 different specialties in our organization and all of our primary care practices and urgent care practices. There's a couple of stragglers that, for reasons of complexity, are going to be a much more long-term and rigorous build to get done. But you know, when somebody gives me I would call it a critical comment, not necessarily a negative comment, but I say that that's just more evidence that this works. That is a positive comment because it means that it's something that they want, and it's something that we're working to give them. And this effort this year has gotten us so far, and we just have the last kind of chunk to get through.
Well, you've shared so much information with us today. I got to ask this one last question. If there's one piece of advice you could give to your peers around the country, maybe at hospitals or organizations that haven't implemented as much of the technology as you have, what would you say to them to encourage them, or what advice would you give them? Carrie, we'll start with you.
Yeah, I think my advice would be is to bring everyone to the table and collaborate closely. So we didn't talk much about this, but we had a really robust executive steering team that included physicians and IS and operations and all of the individuals that are a part of the patient experience, our patient experience team, to really understand what do our patients want and how do we continually evolve to be able to deliver that. And so I think my advice for any organization is make sure you have all the players at the table, make sure you clearly understand the goals that you're trying to achieve, and really what is that voice of the consumer? What are they wanting from us? And I think it's a very exciting time because I think healthcare is working to evolve to what our consumers are experiencing in every other industry. And so that would be my advice. It is coming. It is time for us to step up. I don't like to compare us to Amazon, but we need to keep moving in that direction because they've set a very high bar, and that's what our families want. So bring your team together and understand how you can deliver that experience.
And I think that the biggest thing, Carrie talks about bringing everybody together and having shared goals and shared ownership. And I think that that is making it a whole organization goal and not just who's on that executive team, who's the team lead and your project manager and your IT person building it. So something else that we did is make it one of our annual organizational goals. So we did have a very clear, we want to increase the number of online scheduled appointments by 3%. And we actually have, I think we're currently tracking to exceed it by 16% for the year, looking at Q4 of last year over Q4 of this year. So right now we're trending where over 20% of all of our appointments scheduled for the whole system are scheduled by patients online. And we started the year at 8%. Wow. So the adoption growth has been so exciting and so huge, but it started out very small. And so by making sure that everybody, like I said, is aware in clinic, from the chief of service to the MA rooming the patient, it's not enough to evangelize these tools. You have to be fanatical about these tools. And so I have almost never opened a meeting with somebody without telling them, oh, it's good to talk to you today. Let me just tell you real fast what your online scheduling numbers look like for your areas. Do you think that your teams are being well educated? Are there tools that we can provide? And then we transition to the other mission. But by having the transparency of that data and turning it into a friendly competition. So this week we just wrapped up our summer showdown, a big bracket style competition of all of our different clinics to win a fajita party at the end for who increased their online scheduling the greatest in those number of weeks. Everybody has a seat at the table. Everybody has stake in the game. It's really, we have a slogan of the organization that's one amazing team. And I think that really speaks to trying to bring people on board and seeing, I know that this is an executive goal this year, but how can I contribute to it?
Great. Wow, Carrie, Grace, thank you so much for all the information you shared with us today. It was a lot to unpack there, and I'm glad we got a chance to kind of peek behind the curtain to see what Texas Children's has been up to, and it's a lot. So thank you. Appreciate your time.
Absolutely. Thank you, John.
So if you enjoyed our discussion today, check out our YouTube channel for more, and you can always find more content at Healthcare IT Today. Have a great day, and thanks for listening.